Diabetic wound care and cleaning. Part 6. In this part, the patient will be given Spalk installation due to the asymmetrical position of the bones. Spalk is a tool made of metal, wood or other strong but light materials that is used to immobilize broken bones. The use of Spalk is aimed at resting broken bones so that they do not move and cause pain. As previously mentioned, the use of Spalk is intended to immobilize the bones of the victim. The immobilization referred to here itself is prevents shifting or movement of the broken bone. Avoid soft tissue trauma, soft tissue injury due to sharp bone fractures. Reduces pain experienced by patients. Makes transportation easier and also makes X-ray photos. Resting broken body parts. In the medical world and also in the field, there are several types of Spalk that are generally used. The several types of Spalk are as follows. Improvised Spalk, Splint. Improvised Spalk, Splint is a type of splint that is made in an emergency situation. This type of Spalk can be made from any object that meets the Spalk requirements. For example, wood, umbrellas and others. This type of Spalk itself is used to fix the lower extremities or arms and body. Conventional Spalk, Splint. This conventional Spalk, Splint is a type of Spalk provided by medical or evacuation personnel already prepared. Similar to the previous improvised Spalk, this type of Spalk is also used to fixate the victim's extremities and lower body. In its use, Spalk must be supported by a number of other equipment, which includes triangular bandage for splinting, sterile gauze. When installing Spalk on patients, there are several procedures that are generally used. These procedures include prepare the tools needed, Spalk, cloth dressings for splinting and sterile gauze, splints attached with Spalk to the two broken bone joints. First, measure the victim's healthy contralateral limb first. Tie the Spalk well, not too tight, but not too loose. Make sure there are enough ties, starting from the top to the bottom of the broken bone. That's a little review from us about Spalk, a first aid tool that is commonly used in treating patients who experience crooked, asymmetrical and weak bones. Until now, Spalk is a tool generally carried by medical personnel to evacuate accident victims. Hopefully the short review above is useful for those of you who have watched.